بسم الله والصلاة والسلام على رسول الله وعلى آله وصحبه ومن والاه. أما بعد, Assalamu alaikum wa rahmatullahi wa barakatuh, everyone. My name is Sultan, and I'm really happy to be here, even virtually, with all of you for the Muslim Mental Health Conference. I'm going to share my screen so that we can start, inshallah. So today I wanted to discuss the importance of addressing trauma in faith-based therapy. This is a presentation that I'm doing in collaboration with Najwa Awad. She'll be presenting the second half, which is going to be about the approach that we've created to address faith-based issues in trauma therapy, which is called the Duha approach. So the first thing I think is important to touch on as we're talking about this is the idea of redefining trauma. Oftentimes, even as clinicians, we can view trauma as something very exceptional or uncommon, even though it's a lot more common than typically assumed. So typically, as we see in this diagram, what we would consider traumatic incidents would be very major life-altering experiences. Things like undergoing a natural disaster, people who have been through war, severe abandonment issues, sexual abuse, emotional abuse, things like that would be considered under the umbrella of what is considered a traumatic incident. But what's important to realize is that our definition needs to expand a bit. Small t traumas are also very impactful, particularly if they are compounded, if there are multiple things. So especially with Muslim clients, we're going to be dealing with racial, ethnic, religious microaggressions, divorce, separation, illnesses, financial troubles, extreme stress, conflict with family, things like that can also be really impactful in people's lives as well. A lot of you have probably heard of the Adverse Childhood Experiences study, where a sample of 17,000 individuals were researched, and it was found that 64% of these people who were surveyed had experienced something traumatic during their childhood years. This is really important to realize, because if we're thinking about it as in childhood, 64% of people have experienced something traumatic, if we were to expand that throughout life, throughout adulthood, that number would likely increase. And what they found were a lot of the risks associated with even experiencing one traumatic incident would increase a person's struggles with social functioning, decrease their overall well-being, increase physical health risks, and also increase mental health risks. A lot of mental health issues were popping up with that as well. And this is important to note because when people come into our offices for therapy, we are going to see trauma presenting itself, but often it goes unnoticed, especially when, our Muslim clients come in. Muslims, just like in any other community, are going to experience trauma. But this trauma can be manifested in different ways so that the underlying trauma gets ignored. So we might see anxiety, depression, anger issues, emotional regulation issues, numbness, physical complaints, right? All of these different things can manifest themselves in therapy. And what we often do, because of the misconceptions surrounding the nature of trauma, we focus in on the symptoms, on the byproducts of trauma, rather than healing the source of the symptoms. One major component that is often not identified as a byproduct of trauma, and therefore often goes unhealed and unaddressed, are the spiritual impact that trauma can have on a person, the faith-based doubts that might present themselves after a person has endured a traumatic incident, multiple traumatic incidents, small t, big T traumas. And so our goal is to explore this rarely discussed detrimental impact that trauma can have on faith, in order to promote an understanding of this connection and to provide a holistic psychospiritual approach for counseling our Muslim clients, inshallah. So as far as the Islamic integration of this goes, some of it is going to be obvious in that a person's Islam can be affected by trauma, right? And the ayah in the Quran where Allah subhanahu wa ta'ala says, do people think that they will be left to say we believe and they will not be tried? Right? That Allah subhanahu wa ta'ala is guaranteeing that there are going to be trials, that there's going to be different traumatic incidents that people are going to undergo. And in this process, that can also impact a person's faith. So the idea that so many of us have been impacted by trauma, and when a person's faith gets shaken, two and two are not put together, right? So in this diagram, you can see all of these different residual effects, like just your soul feeling heavy, right? Struggling to connect with others, so relational difficulties, restlessness, anxiety, feelings of emptiness, feelings of sadness and depression, right? Inability to deal with stress well, overwhelming shame. All of these can be byproducts of trauma. All of these can be byproducts of the trials that Allah subhanahu wa ta'ala mentions in these ayat. And so when we're dealing with Muslim clients, it's really important to have an understanding that trauma affects our mind, body, and soul. The soul is not often discussed in that, right? But when a person has been through trauma and is in that fight or flight response mode, their brain has changed and a problematic response begins to become the norm. And just like it's going to be very pervasive throughout their mind and body, it can naturally also affect their spirituality. If a person's thoughts, if their person's mind after trauma has been impacted, then naturally faith-based doubts are not so far-fetched, right? So thoughts like, why does God allow bad things to happen to good people? You know, if God allowed this to happen, then he must hate me, right? All of these faith-based doubts can be an effect of trauma. And so when a person has experienced trauma, you know, we see so much research surrounding the impact that it has on a person's mind, neuroscientifically what it has on their brain, and then also on their body. There's been a lot more research in terms of the of trauma being stored in the body, but there has really been very minimal research with regards to the impact that this has on faith, with regards to the impact that trauma would have on the heart, the soul of a survivor of trauma. But by increasing the awareness, and the goal of this, by increasing the awareness of the impact that trauma can have on faith, the healing process can begin, because it can alleviate the shame that a lot of people really associate with faith-based doubts. And so when we identify that there's a link between trauma and feeling shaky in your faith, feeling a struggle in your spirituality, it alleviates a lot of that shame. It also allows people to differentiate their identity as a Muslim from the doubts that they're struggling with. This also through use of different verses from the Quran, different hadiths from the Prophet ﷺ, through different methods in the Islamic tradition, you provide reassurance that some of the most righteous people have also struggled with trauma. So that's very validating and allows people to not feel so alone in what they're experiencing. It also provides a holistic model to address the mind and the body and the heart in order to begin to heal from trauma. And it integrates Islamic approaches with traditional psychological approaches needed to treat trauma in order to further promote healing as well. And so as we are talking about this, it's important to realize that there is a lot of research out there with regards to the positive impact that spirituality can have on helping people to cope with trauma, and how trauma can deepen a person's faith. But very little has been, as stated, very little has been added in to discuss the negative impacts that trauma can have on faith. And so in knowing that faith can be a helpful coping skill for trauma, then allowing individuals to re-access their connection with Allah subhanahu wa ta'ala can increase the mechanisms at their disposal to progress in their healing journey. And so this is one of the main reasons that a lot of times, if you are getting Muslim clients into your office, a lot of times they might actually be seeking out this Islamically integrated approach in the hopes that a more holistic approach is going to help them to feel understood, and that all of their different struggles, all of the different impacts of trauma can be addressed. And so how does this look and how does this show up in practical clinical application? So in our clinical experience, we have seen a lot of clients come into our offices that have experienced trauma and have been very impacted in terms of their faith because of that trauma. We've noticed this very strong link between trauma and faith-based doubts, and we've even seen that this can contribute to an increase in atheism and agnosticism as well. And so our hypothesis is that healing trauma and reconciling, while simultaneously reconciling any negative views, tainted views about religion that our client comes in with, can potentially increase faith and also be a part of healing from the trauma that they've experienced. And so rewiring the response to trauma through a lot of different angles, through mind, body, and heart, can really help people to access all of these different parts of themselves and have a very profound impact on the different facets that they're really struggling with. So when we think about why would trauma impact a person's faith, like why would this link exist? Consider the impact that trauma has on people, right? When people have gone through trauma, they experience a lack of safety. Their autonomic nervous system is dysregulated. There is an overactivation of their threat stress response system. And then they also will typically struggle connecting socially or relationally with family as well, because of a struggle to trust and to be vulnerable. All of these different components are really important in being able to establish a healthy connection with God. And so if they're struggling with these things in their typical lives, it's naturally going to lead to a struggle in their spirituality as well. And so as these components are addressed through, as autonomic system dysregulation is addressed, as the threat response is addressed, as feelings of safety start to come back, as relational issues start to be addressed, and as the trauma begins to be healed through standard trauma work, right? Through whether it's self-regulation, cognitive reframing, grief work, whatever is needed for that client to progress, spiritual components can also be introduced in order to address the misconceptions that the client is struggling with regards to their faith. So that just like we're helping our clients to heal from the impact that trauma is having on other relationships in their lives, we can also help them to heal the impact that trauma is having on their relationship with Allah subhanahu wa ta'ala as well. And that can be really, really powerful. And so creating an understanding for ourselves and for our clients that faith-based struggles due to a traumatic incident are a manifestation of that ongoing trauma, a perpetual cycle of trauma, like a threat response, where that trauma is being maintained, and that is what is impacting their faith. That identification and awareness can be a start to help break that pattern. And so in the same way that we address all of these other things in our trauma work, we can really start to address the underlying needs, the underlying lack of safety, to help them to reestablish safety and connection in their relationship with Allah subhanahu wa ta'ala. And in them understanding that, hey, this is just your trauma manifesting itself, that can alleviate so much shame in what they're feeling. And so if you're wondering how to practically integrate this into your session, so Najwa is going to go into it a little bit more in the Doha approach, but just to give you some ideas. In the assessment phase of your initial sessions with clients, just as you would assess other symptoms of trauma, just as you would assess for traumatic incidents and experiences, you can also assess for faith-based struggles as well. So you might ask them, tell me a little bit about the role of spirituality in your life. How has your spirituality shifted during different stages of your life, right? And so, as they're talking about different things in terms of the symptoms that have come up since a traumatic incident, you can also ask, okay, have you noticed any shift in your faith, in your spirituality since that happened? So that's how you can kind of start to put two and two together. Addressing faith-based doubts, one thing that's really important to consider is that it has to only be done with clients who are seeking this out. So psychoeducation about the impact that trauma can have on faith can be really validating and normalizing and grounding, but it has to come from the client. The client has to want this and has to initiate conversation as well about their struggles with spirituality. This is not something that can be pushed on them. One example, just to kind of give you an idea of how this might show up in sessions, is if a client is talking about some of their faith struggles, and the client says something like, I really struggle to make dua. I just can't fully allow myself to believe that Allah subhanahu wa ta'ala is going to answer my prayers. And so the therapist might respond with, it makes sense that making dua and trusting that dua would be accepted would be difficult for you right now. You were betrayed by somebody that you trusted. And so being vulnerable and pouring your heart out and trusting that someone is going to fulfill your needs is a huge struggle after experiencing a trauma like that, right? So helping them to realize that even if intellectually they know that their relationship with God is different than their relationship with other people, their body, their heart, their the trauma response system in their brain does not differentiate that. And for them to know that and to realize that, yeah, it's normal to struggle with trust, even if rationally you realize that Allah subhanahu wa ta'ala is different, that can alleviate so much shame and really provide a lot of validation. And so understanding, number one, that trauma is very common and that it has pervasive impacts throughout the mind, body, and heart and soul of survivors of trauma. And that addressing the impact that trauma has on spirituality can present a more holistic approach, but also provide validation, normalization, and the alleviation of shame in Muslim clients seeking treatment. All of that can really have a very profound impact on healing trauma and then healing the struggles that our clients have in their relationship with Allah subhanahu wa ta'ala. And so Najwa is going to go into the Duha approach, which is a holistic model that we created to be able to integrate spirituality into trauma work. She'll be presenting on that. And if you want more in-depth information on this and some concrete approaches that you can use in sessions with clients with this, Najwa and I have an 11-part video and article series called Your Lord Has Not Forsaken You, addressing the impact of trauma on faith. And it is on Yaqeen Institute's website. And so you can check that out there. Jazakumullah khairan for listening. Assalamu alaikum wa rahmatullah.